No, they do is one here, I'm not life. Welcome, guys. Is anybody in the building? Guys, you're welcome. Guys, if you want to come to the stage, I pinned a link down there. Follow the link to come to the stage. Welcome, Priceless. Guys, follow the link and come up to the stage if you have your questions. Guys, you are all welcome. Perpetua, welcome. Simon, welcome. Dixon. I can see all of you guys. Guys, hit the like button, like this video and share it out. There is a link I pinned on the comment section. Guys, check the comment section, follow that link and come up to the stage. I just shared the link, guys. Perpetua, you are welcome. Guys, as you are joining, hit the like button, okay? Then share this live stream. Joy, you are welcome. Who is coming to the stage? Guys, come up the stage. Let's start. Ask questions. Come up the stage. I dropped the link for you guys. Cecilia, you are welcome. Welcome, guys. Your captain is here. Let's roll. Let's roll. I'm ready for your questions. Okay, I have people ready. Okay. So, guys, if you are not speaking, you can mute yourself if you are not speaking at the moment. So, who ask your question, guys? I'm here now. Let's interact. Naomi, welcome. I see you. Good evening, dear. Welcome, everyone.
Good evening.
Good evening, dear. How are you?
I'm fine. Nice to find you. Hello,
Okay.
can you hear me? Okay.
Yes, I can hear you, sir. I can hear you.
I'm really grateful I come across your channel.
Okay.
And I'll be blessed. Oh, what you'll be sharing. God bless you. Well, I have a question. Okay, I have a question. The same, what is it called? The same, are there the same opportunities in Canada, like the same opportunity we have in the UK, concerning healthcare immigration, or if someone wants to migrate to Canada through the health assistant pathway?
Yes, they are the same thing. It's the same route. Yeah.
Is it the same process?
Yes, it's the same process. The only thing with Canada, I've said it before, is that you will show a proof of fund, and that proof of fund will be in your account for 6 months.
6 months?
Yes, the proof of fund, like when I did my interview, my employer told me that, I don't know if it's because of my family of 4, she didn't specify it, okay? She told me that I will have 6,200 Canadian dollars in my account for 6 months before I will apply for visa.
Okay.
So it's the same CV I used to get my job in UK that I used to get a job in Canada. It's the same course I did, nothing else, nothing more. The only difference is that all these things are easy. I tell you guys, once you are serious about it, you will get there.
Knowledge
I
is
used
power.
to tell you guys, it's the same process. So just know that for Canada, they will not sponsor you like UK will do, okay? You will have to keep your money in your account and all that. You bring yourself.
Okay.
That's just the difference. Yeah.
Thanks. And the CV is different from Canada CV is different from the UK CV too.
It's
That is
not
only
this, it's not different. They are the same CV.
okay, the
The
same.
only thing with Canada, when you're applying for Canada, okay,
Yes, ma'am.
Canada does not say healthcare assistant. Canada will use the word nurse aid, okay, or
Not what?
healthcare aid, nurse aid,
Oh, it's not paid or
or
healthcare. Okay.
healthcare aid. I don't know if
Okay.
you're getting it now. So if you're
Yes.
applying to Canada, you will use those terms. It's the same CV. So instead of you saying healthcare assistant, you just say nurse aid. Okay. Yeah, something like that. Let me get it for you guys. Hold on.
All
Let me
right.
get
Thanks.
the exact terms for you guys.
Okay.
But that will make me going off from this. Okay, let me use my system. Don't worry. I'm here too on the system. My system is close to me. Let me get the exact keywords for Canada for you guys. I'm searching for my employers now. Mm. Hold on, guys.
All
Welcome
right.
to everyone. I'm coming. I'm searching for the email, guys. I'm coming. Guys, you are
Uh,
welcome. Share this live stream out. You might be helping somebody. And if you're on this live stream, you have not subscribed to my channel. What have I done to you? I'm coming, guys. I'm trying to get Canadian terms for you guys. I have got a lot of email from my employer. I'm searching for the right one to get what I need. Okay. Now, Canada have codes for all these things, okay?
okay.
So for nurse aid is 3413, okay? Maybe when you are applying, they will ask you for the code, okay? And that is level C. Now, let me call this thing for you, their terms. Let's say if you're applying to Canada, maybe you see a job in Canada, you have to change your CV. The only thing you have to do is that you just change the headlines. Like for UK, that you say your CV might say healthcare assistant, right? You just
Okay.
change it using their own terms. Now, let me call their terms for you. Example, the title of your CV, if you are doing for Canada, should be either healthcare aid, okay, or nurse aid, or
Okay.
patient care aid, or
Okay.
resident care aid. You get it?
Okay.
Depending
Yes, ma'am.
on where you are applying and the job description. Okay,
Okay.
guys, you are
Resident.
all welcome. Yeah, resident care aid, health care aid. Instead of healthcare assistant, they don't use the word assistant. Then they
It's
use the
eight.
word aid. Yeah,
Oh,
Okay.
hospital attendant, nursing attendant, patient care
Okay.
aid, patient service associate. Okay, all of them are in the same category. I don't know if I'm communicating.
yes,
That's
Okay.
just
you
the
are.
difference. And the level is level C. Okay, that's just the difference. If not, every other thing is the same.
Then NOC 3 what?
NOC 3413.
341 3.
Welcome, guys. Yeah.
All
Guys,
right.
Hello.
hit the like button. If you are here, like this video, please. Share it
Sorry,
out
ma.
to your social media. It doesn't cost anything to share. Let others come and gain from the knowledge.
I
Good
have a
evening.
last question. Sorry for taking your time. My last question. Can you hear me?
Yeah, I can hear you.
My last question. Must you have a health background, or you can work in an hospital for like 6 months or like 12 months before applying.
Okay, this your question shows that you have not been watching my video. You know, I
I
will catch
have.
all of you today.
I've
I
been
will
watching
catch
your
all of you
videos.
today. If you
So
have
I
been
have.
watching, I used to say it on my video. Guys, share, I used to say it.
I'm even a
Guys, hope I used
subscriber.
to shout it every day.
Yes.
For example, me, I'm an engineer. Engineer, is it a hospital background? No.
No, ma.
The only thing you have to do is do the 15 care courses, the mandatory 15 care courses. Do diploma if you can. Then
Okay.
volunteer in a hospital or in a care home, as the case may be. They only
I'm
want to
doing
make
that.
sure that you have experience, you have cared for someone. Even caring for your mother, your father, your grandparents is an experience. But
Yes,
because
ma.
of how competitive this job is, okay, and because you will be needing references, that's why we always tell you to volunteer in a hospital setting or in a care home setting.
Okay.
True.
All right. Thanks.
Welcome, Ennis, welcome.
Thanks so much,
Bola,
ma.
welcome. I see all of you.
I hope
Welcome,
I
guys.
can go now so that you can tell to others.
No
Can I?
problem, no problem.
All right.
Yeah,
Thanks
you
so
can
much.
go down now, yeah. Because you
Okay.
can
Thank
only have 6 people on the screen. Hope I
you. Okay.
answered all your questions.
All right, ma. Yes, ma.
Okay. Welcome,
I can
Good
Christina.
DM
Welcome,
evening.
guys.
I can DM me
Good
if I
evening.
need other assistance.
Guys, hit the like button. Hit the like button. Share this video. Don't be stingy. Oh. You see me now, and I'm not stingy with the information. Help somebody
Hello, good
else.
evening. Good evening.
Ma, I'm likely DM you if I need further assistance, please. I hope you will
I'm
not
with you.
mind.
I'm with you. That's your question.
I said I hope you will not
Okay,
mind if I DM you for further directives.
No, no, send me mail. No problem. Once I have time, I will check it out and I'll answer you.
Okay, all right. Thanks so much, ma. All right,
You're
bye.
welcome.
so
Bye for
first
now.
of
Bye.
all, I want to
Don't
thank
go,
you
stay
for
in the
the work
background
you are
so you listen
doing.
to
Yes,
other
yes.
questions and learn too.
Okay, I want to first of all thank you for the good job you're doing. I've been following you for like a month now. Wonderful job.
Wow.
I've gone through your video on TV and cover letter. Wonderful job. Though I've been on this for a very since last year, even before the care job actually started. But for some time, I just like took my mind off, but I'm back on it. So recently, I've done some certificate courses in Allison. So recently, like a week back, I just noticed that Allison has diploma in caregiving. Going through it, I was like, I'm wondering why we are doing certificate courses when we can just do this diploma in caregiving and you have all what you want in it. So I don't know. I want you to throw more light on that. Why would we go for certificate courses if we can do a diploma in caregiving and it encompasses everything on the 15 care certificate? Thank you,
Okay,
ma'am.
now, this is what happens, okay? It is not all diploma that have the 15 care courses in them,
Okay.
right?
Yeah.
And the truth of the matter is these 15 care
True.
courses are not even costly. What is £10? Florence Academy is free. To me, anything I can sacrifice to get what I want, I will sacrifice.
True.
These 15 care courses are just like a standard. If you watch it, it touches all the angle of care. The employer wants to make sure that you have touched all the angles of care. You have an insight of what you are coming to do. I don't know if I'm communicating.
Yes, you are.
It is
Yes.
not all diploma. We have a lot of companies offering diploma, a lot of sites. It is not all of them that might cover these 15 care courses. So to me, these 15 care courses is not difficult to do. It can take you a day, depending on how serious you are. You can sit down and finish the courses. It can take you 2 days. It's self-paced. So if it is what you need to get the job, why can't you do it? So I don't see anything there left for me. They are all good. The thing is, just do whatever you can do to get what you want.
Okay. Okay.
Yeah,
Thank you.
You're
So I would
welcome.
want to know, like I'm using Allison. Basically, I'm using Allison. Can
Okay,
Allison
Allison
fly?
is good.
Okay, okay. Thank you so
I
much.
keep
I'm
saying it.
grateful.
Allison is good. The course I
Because
posted
that's
on
what
my channel was the one I did, and I stated it there. This is what I did, right? I stated it on my channel as well. This is what I did. Does not mean that that's what you must do.
yes,
There is
definitely.
Allison, there is London, whatever. There is a lot of them out there. So far, it is CPD accredited. Is it's recognized in the UK, or I don't know. It's okay. So do
Okay.
what works for you. Yeah,
Thank you very much. I'm grateful.
you're
Let me
welcome.
log on so someone else can join also.
No
Thank you.
problem. All right. Guys, hit the
Hello,
like
Ada.
button. I'm coming, darling. Somebody is asking me, is this job only meant for women? No. I keep saying it. It's for everybody. In my company, I have a lot of men that were employed from Nigeria too that are working here. So everybody can do the job. If you come here, a lot of men are into care. You get? It's for all gender. It's just like you asking if nurses is for women only. If you come to the hospital, you see male nurses, you see female nurses. So any gender can do the job. What matters is how you package yourself and how you present yourself to stand out. So Logan, you can go ahead. Guys, share this video out.
Hi, Ada.
We are 27 on the
Hi,
screen,
Ada.
but
How are
only
you?
23 likes. Hit the like button, guys. It doesn't cost you anything. Share it so that others will benefit. Logan, go ahead.
Hi, Ada. How are you doing?
I'm good there.
Right. I want to say a big thank you and all that. I've been following lots of channels on YouTube, but you really, really did stand out. Like you usually say, you really did stand out because you go the
Thank
extra
you.
mile to give. Yeah, you go the extra mile to give the information. Like I'm not really new to healthcare. I've been into the healthcare system since 2004. So a lot of information you are giving is really, really out there and really, really good. Right. What I'm wanting to know, the certificate, the certificate the courses we are having now, like those 15 free courses and the ones on Allison or Florence, are they acceptable in Canada?
I just said it now. Yes, they are.
Okay,
They
that's
are
fine.
the
That's
same
all
thing.
my question. Oh,
They
that's
are
all.
the same thing. Care
Okay.
is care anywhere. Care
Okay.
is care,
Yeah.
no matter the country. Okay? What these
Okay.
people basically want to know
Okay.
is that you know the basics. I don't know if
Yes.
you're getting me.
Yes.
So no matter the country,
Yeah.
all these courses you did is the same thing. Your CV is the same
Okay.
thing. Like I said, I mentioned a lot of keywords. If you want to focus on applying to Canada, these are the right keywords to use because this is the keywords
Yeah.
they use, right? When
Yes.
I
Yeah.
applied for Canada,
Yeah.
I just use my same CV and I use healthcare aid. That's all. You get it? They are the same thing.
Yes. 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 All right then. Thank you so much and congratulations
Thank
for your
you.
milestones.
Oh,
All
thank you.
right.
It's
Bye.
done. Bye.
Bye.
Guys, come up to the stage. Are you people scared to come to the stage? Itunu, how are you? Guys, come up the stage. Itunu, we cannot hear you. We cannot hear you, dear. We can't hear you. Hello, Itunu. Lillian, welcome. Guys, hit the like button. Hit the like button, guys. Share this video out. Let others come and get value. Guys, come up the stage. Come and ask your questions. Itunu, we cannot hear you. Speak up. Speak out. We can't hear you. Welcome, Ijoma. Lillian, I see you. Guys, climb the stage. Come and ask your question. If you are here, smash the like button, guys. Share this video out. Let people come and join us. Someone should go to the group and let them know we are live already. I am ready now to answer your questions. Bring it on now. Nikki, you are welcome on stage.
Thank you so much. Good evening.
Thank you, MSC. Yeah. Go ahead.
As I always say, you are one in a million.
Thank
so
you.
grateful for taking time to always explain things in details. But there's one particular question that has been bothering me since I started watching the video. And I'm a registered nurse in my country, Ghana. And I want to find out if I also have to do these care. I've done the 15 courses already. I don't know whether I should go ahead and do extra courses like the Allison and stuff.
Now, I keep saying this even on my I keep saying this even in my video. Hold on, before I answer you, let me treat this question. Hold on there. Hey lad, I welcome this job, but let me treat this before question messages used to go and come. Sources seems to be saying the healthcare route is closing up soon in the UK, and we have been applying and not gotten response yet. Thank you. What are the causes? Sources. Where did you hear these sources? Oluwa Semilogo. Oh, Marquis. Sorry, I'm not good with pronouncing names. I'm so sorry. Where did you get this your source? Because that your source is not telling you the truth. UK government have never come out officially to say that they are ending the care worker route. In fact, there is still a lot of vacancies everywhere. They are still in shortage. So I don't know where the source is telling you that. So Nikki, let's go back to your question there. I wanted to answer that question because messages will come and they will go.
No problem. I wanted to find out, I'm a nurse in my country. And I've done the 15 courses already. So I want to find out if there's still a need to go ahead and do a lesson and stuff. I hold a diploma in nursing already.
Okay, like I said, I used to say this before. If you are a nurse, okay, and you want to go through the care route, you have to take your nursing and keep that. Why is it in echoing? I don't know why this is.
I didn't get you, please.
I said. God, this is echoing. Why the echo? Can you hear me? Please mute yourself. If you are not talking, mute yourself. Nikki, mute yourself. Now mute yourself. You see, the echo have gone back. It has stopped. So now, as I'm saying, Nikki, can you hear me?
Yes, I can hear you, please.
Nikki, mute yourself. I think this is from you. Good. So guys, I keep saying this. If you are a nurse and you don't want to come to the UK as a nurse, take your nursing background and keep it somewhere. Because the truth is this, there's one thing with UK. If they are employing you as a nurse, you are coming as a nurse. If they're employing as a senior carer, they want to see that you have been a senior carer or a healthcare assistant. So if you are coming as a healthcare assistant, a senior carer, your CV should be senior carer. All your job description should be about a senior carer or a healthcare assistant. You cannot write on the title of your CV healthcare assistant and on your at the job description, you're talking about what you do as a nurse. They did not rhyme. So I always advise people, if you're not, come as a nurse. But a lot of people are saying that it's difficult for them to come here as a nurse. So in that case, if you are finding it difficult to come as a nurse, I will strongly recommend coming as a senior carer or a healthcare assistant. Tailor your CV as one. Please, if you are here, meet yourself. Just about meet your video, meet yourself to avoid the echo. Mute yourself if you are not talking. Good. So as I'm talking, Nikki, go to your CV. Yes, if you are coming as a senior carer or healthcare assistant, you must do diploma. Okay, you must do the 15 care courses. But when you are talking about education, you put in your education nursing, that you are a nurse. I don't know if you are getting it now. You put in your education, put down your nursing background, there is fine. But all your job description should be what? Senior carer or healthcare assistant. Unless you are going in as a nurse, you can put it. You can put your description as a nurse. So to me, getting all this knowledge is not a waste. Knowledge is not a waste. So far, you have the money to do diploma, do it. No knowledge is a waste. The 15 care courses, the knowledge there is not a waste. I don't know if I'm communicating. Nikki, can you hear me now? Someone said, Mark is saying the truth is, Marcus, let me address you now. The truth is that a lot of YouTubers do a lot of things for views. That's why you people don't see me coming to say company recruiting this and that. I like doing my research and having facts before I speak. Yesterday, the other day in the group, I told you guys about looking for companies that are recruiting. I've been looking out for them. Some that I got, I reached to them. They said they are not giving them what are they calling it? Oversee. They don't have them course now, but they are able to sponsor people that are already in the UK. And these companies now are what I see some YouTubers out there posting that they are recruiting. So that's it. A lot of YouTubers there are just after the views. They can sell anything. Anything you don't hear directly from UKVI or from the UK government does not exist. So UK is still recruiting healthcare workers. In fact, there is a huge shortage here. So don't be discouraged. Whenever you hear something from YouTubers, go to Google and make your own research. Go to UK government website and make your research. That's my advice to anybody. There are a few YouTubers on this street that have integrity, that are after giving out real information. A lot are after the clickbait. A lot are after the views. So always make your own research. So the next question, as we move on.
Good evening, everyone.
Good evening.
Hello, my captain.
Yeah, baby. Know me. You have been so supportive. I see you all the time. Thank you.
I always take always because I want to stay up on top of the game. So now my question now is that now I'm gonna write my ELETs. I wanted to check with you now. Is it advisable for me to do also my TB, or I must wait to get a course, then I can do my TB?
You're a nurse?
I'm going to write my English now, and the way I write my English, they also do the TB test. So now I wanted to check with you, is it advisable for me to do also the TB test? I must wait until I get the course to do TB, which is going to expire within 6 months.
Like I always say, TB test expires. Police clearance expires. International driver's license expired. I don't advise people to do TB test if you have not gotten a job. The most important documents you need before you start is the IELTS, your CV, your cover letter, and your original driver's license. There is a difference between driver's license and international driver's license. International driver's license is just a document you need to, drive in the UK for 1 year only before you get the UK license. And before you talk about international driver's, you should show your main driver's license, right? So all these documents that expires, I don't advise you to get them because it's waste of money. Once it expires, you cannot use it. So focus on getting your IELTS, your CV, and your cover letter. Start applying while you are learning to drive if you don't know how to drive. Okay? Once you get your original license, attach it, keep applying. When you now get an employer, TB test does not take time to do, right? You do your TB test, get your police report. Once your visa is out, you start talking about changing your driver's license to international driver's license. That's when visa is out, because it start counting the day you get it. Your 1 year start counting the day you get it.
I think
is it clear now?
Clear, yes. I understand. Thank you.
Is it clear? You're welcome.
Yes.
Okay, guys, let me take a few questions from the comment section before I come back to those of you on the screen. This person said, Christina, what is the difference between senior care and HCA, please? The only difference is that as a senior carer, you are like a leader. It's more of leadership role. I keep saying it. All of you do the same job on the field. But being a senior carer, you are more of a leader. The healthcare assistant reports to you while you report to the manager. Also, depending on the company. Like in my own company now, as a senior carer, I have admin work. And admin work pays more than going to the field. That's just reality. There are some days I will work in the office, okay, to see that the business is running smoothly, to take calls from our clients. Sometimes I might be in my home, the office phone will be transferred to my own phone. I will be answering calls from my home. I'm being paid. I get paid as high as £30 per hour doing a senior carer job, like sitting in the office. So this is just the difference. They are the same thing. It's the same job you do on the field. The only difference is that as a senior carer, you are a leader. That's just the difference. I hope that answers your question, Cynthia. Now, this person said, please, ma, so when drafting the CV and I state my working experience, shall I write registered nurse or example? Present Holy Trinity Hospital, registered nurse. Is this right? You can put that if you are going as a nurse. If you are going as a senior carer, this shouldn't be what your CV should look like. Your CV should look like senior carer. I keep saying it because the employer is looking for a senior carer, not a nurse. And I keep saying it, I recommend it. If you're a nurse, pursue the nurse route. Leave the senior carer and the HCA for people that are not in the health background. Because the truth is that you still get more paid as a nurse depending on where you are working, whether the NHS or the care home. Of course, the care home pays higher than the NHS. So you get paid higher as a nurse than a senior carer or a HCA. So why are you coming to be a senior carer or HCA? Go straight to becoming a nurse. A lot of NHS trusts are employing nurses daily. I know a lot of them employing. My next video coming up on Thursday is to teach you guys how to apply on the NHS website, whether as a HCA or as a nurse, how to write your supporting statement and stand out. They're employing. Why not go to the NHS as a nurse than coming to drag senior carer position at BHCA with those of us that does not have health background? Somebody said, please, I want to inquire what is needed in a reference letter. The truth is this, I never get to see my reference letter. The employer will not give you your reference letter. It is none of your business. Reference letter goes direct to your referee. Unless the person has a personal relationship with you to show you. The people that reference you never show me the reference letter. I don't know if I'm communicating now. So this shouldn't be your worry now. Your worry now should be how to go and tailor your CV, your cover letter, and get the job. When it's time for reference, your referee will get the reference from your employer. It is not your document. They will not send it to you. So I don't know how it looks like. I have never had anyone myself. Someone says, what about ethics? Yeah, you can write ethics. You can write IELTS. You can do NARIC. But like I say, if you don't have a health background, respect yourself and go and write IELTS. Yes. I have seen a lot of people that during their visa application, UKVI, maybe they have bad luck. UKVI will start digging deep into their profession. But when you write IELTS, you don't have any business to present your certificate, your original background to UKVI. I don't know if somebody is getting it now. I strongly recommend IELTS if you don't have a health background. If you have a health background, yes, go ahead and do NARIC, do ECTIS. But if not, go and respect yourself and write the IELTS. The score for UKVI General IELTS for healthcare work is so poor, it's so small. Anybody can get this. It's not difficult. Leave NARIC alone, leave ECTIS, do IELTS. It's not difficult. Because your village people might remember you when you want to apply for visa. And they will start digging deep into your background. It happens. It has happened to a lot of people that I know. You see, UKV, I start asking you to provide your original school certificate. Some self, they will go as high as asking you for reference while you are giving your employer reference. So try to avoid it. That's my advice. That's what I feel. So those of you on the screen, oh yeah, let me have your questions.
Hello. Hi, Ada. Good evening,
Good evening,
everyone.
Tushaba. Good evening. Welcome.
Kudos to my baby mama. Too good enough never is. That's my slogan. You're too good,
Yeah.
girl.
Thank you,
See, Ada,
darling.
there's something. I had an interview today, and by the grace of God, your interview tips were top notch. It helped a lot. It built my confidence. Just like I
How?
said in the chat, the question didn't really come the same, but the confidence that yes, I was prepared, you know, made it easier, a lot easier for me. They were all saying great, great. So I'm hoping that by tomorrow they should reply me back
They
and it's gonna
must.
be positive. But
They
meanwhile,
must.
this is my former they are my former employer when I was doing
Okay.
my master's in UK, but
Okay.
management has changed. So it's entirely
Okay.
different people.
Okay.
So now my question is this. There's something you said now that struck me about
Mm.
IELTS. I never did IELTS because I was saying that I have a degree in the UK. So stuff like that. I'll
No, you
use
don't
my
need English language. Since you have a degree in the UK, you don't need English language. You don't need IELTS.
but it's not head background
No
degree.
problem. So far is UK,
Okay.
right? Like I said, it
Okay.
works for some people. I said, like for me, I will recommend. I don't know
Mm.
if don't mistake that.
I
Get the
understand you.
keyword here. You
Mhm.
get NARIC is good, ECTIS is good,
Okay.
IELTS is good. As you have
Mm.
background in UK, they cannot deny
Mm.
you visa. You get my point?
Okay.
Yeah,
Yeah.
just to be on the safer side. I never said they are
Mm.
not good, they are good.
No,
I'm
I
just saying
understand
from my
you.
own point of view. You get
And you
it?
are right. Yes, and it makes a lot of sense. It really makes it does make sense. So my question, because these people, this my former employer, they were saying something today. They want me, if they employ me, they want me to come as quick as possible. Now,
Okay.
leaving my children behind. So
Why
that
do
is
you
to
want to
say,
leave your children behind?
my sister, this is the problem. I've been thinking about it because the guy at the top will not be able to handle them alone now. Now, I
Okay.
don't know. And the point is that I never knew this was going to come this quick because they never gave me a positive reply when I first contacted them. Do you understand? So now
Yeah.
I don't have funds in the account for proof of funds. Do you understand? So
Mm.
if they seek maintenance for me, do they have to say for family? Is it
Where
like
they
that?
take maintenance, they will state it there. What you can, oh, my system is off. No, no, no. Why now? Guys,
Sorry.
why is it shaking? For example, because I'm using the system to get people's question.
Mm,
For example, what's going on? The way the thing looks like is
mm.
I would have shown you by my system now. I would have gotten it here, but I don't know why this is shaking. God, why? So now the truth is this: the on the this thing, guys. I'm sorry. Okay, let me fix my
Take
system.
your time. Take your time there.
So on the course, okay, what they would, what they write on the course exactly is maintenance for you and your dependent is together. They don't take it separately. Okay? They don't take it separately. So if it is ticked, it's ticked. But I would advise you, I keep saying it, depending on the ages of your kids. I don't know the ages of your kids.
7 for 18 months.
You cannot do it alone, my darling. Leave them with your mother. Unless your man is coming with you. And only you knows how supportive your husband is. All men are not supportive. Some men have this Nigerian mentality of I'm the man, I don't need to do the chores. It does not work like that abroad. That's why you see a lot of people come abroad, they divorce. It's because of this African mentality. It does not work like that here. Here, my husband cooks, my husband washes, he bathes the kids, he does every house chore while I'm away. That is how abroad works. And any man that is not willing to do all these things, you cannot come here with your kids. Because these government people will collect your kids from you. It's real. It's real. They collect people's kids. Okay? You all need a supportive husband to be able to do it. So if your kids are small, I strongly recommend leave them back home, come first, settle down, know how you want to run it, and then you can bring them.
I actually have family in UK. My brother and the wife is there. My younger brother is there. We can manage. My problem is these people are saying that they need, if they employ me, they need me to come as quick as possible.
Then leave your children and come first. When you settle down, you know how you want to do your kids. You can bring them. The cocoa is to land here first. You can always bring them anytime you want. Anytime you want, you can bring your family.
Thinking, my husband may not accept.
See, let me tell you another thing I would say. Like, guys, see, I am somebody that I used to say it. I don't like hiding things. Japa, I said it in my last video. Japa is not for the faint-hearted. You need to be financially, mentally, psychologically, and emotionally balanced before you talk about japaing. If you are a woman, you are here listening to my voice. You have kids and your husband does not support your japa. My sister, sit back. Don't go and drag anything with your husband because of relocation. Because it is not easy. It is not easy. So this is what you have to sit down and discuss with your husband, okay? And come at a conclusion.
Like me, he wants us to go. But the point is that he wants, if I'm going, I should go with the children immediately. We should all go.
But now, if you want all of you to go, good and fine. Nothing is there. See, my darling, it doesn't waste time. See what I did. Immediately you get your course, start your visa application. Once you apply for your visa, now, and you get your number, there is a number they will give you, GWF number, when you apply for visa. Use the number and apply for all of you immediately. Don't book your appointment yet. Okay? After the whole application, you now book all of you appointments so that it will become together. That way, the visa will come out once.
So
your visa will come out once. If your husband is willing to relocate with you, that's the best. Now all of you should come. It's better. At least if you go to work and come back, you see your family.
Okay, that's fine. Okay, then.
Yeah.
That's fine then. That's fine. Right. Then another thing I want you to hammer on for those of us getting interview, they should try and read well on safeguarding. Please hammer it. Safeguarding must surely come out.
Exactly. Shebi, I said it on my video. I said it on my interview video. Safeguarding was there. There is no question in here that safeguarding will not come out. You see safeguarding, you see dementia. These two things will always come out. Another thing that must come out is CPR, heart attack, because it's one thing that is very rampant. Heart attack, they must ask you about heart attack. So you have to read safeguarding, dementia, and CPR. I can't stress on it enough. I keep saying it.
Yes, and fall. When a patient falls, the rule is don't touch. All those things. They want to hear that rule, don't touch. So please keep telling us, my sister. My interview today was not for the faint-hearted. I tell you.
It's never for the faint-hearted. That's why I said when you are going for this, you have to be confident and relax.
Like the way you told us to be smiling, I was smiling like somebody that they were touching from somewhere. Oh God, that died. It's not easy, but thank you. Thank you. Thank you. God bless
Guys,
you.
hit the like button now. Why don't you people want to like this video? Hit the like button and share it out. We have 43 million people on this screen. Why am I getting only 34 likes? Hit the like button now. Share it out. Let others join and benefit. Okay, let's take some questions from the background. This person, I love what Devo said. Please, the health and social care level 5 diploma and health and social care level 3. Which one is good for the senior carer role? Guys, these things are just level by level. How do you jump to level 5? Why you never do level 2 and 3? It's level by level. All of them, you have to understand one to move to the other one, right? I think you count 3, you count 5. Me that got senior carer role is only level 2 I did. I keep saying this, graces are not the same. You can even do level 3, the senior carer role you will not see. Graces are not the same. How you package your CV and your cover letter matters a lot. Okay? So if I should advise you, start from level 2, level 3 before you go to level 5. I don't know if I communicated well. This Emu Esiri said, please, I want to know the type of IELTS to write for the Canada route. Guys, I only write only one IELTS, which is the UKVI General IELTS, and I use it for Canada. Canada accepts UKVI General IELTS, but UK, we never accept any other IELTS that is not their IELTS for job. Am I communicating? So if you write the UKVI General IELTS, you can use it for Canada. Naomi said, thank you so much, Ada. Okay. Thank you, Naomi. Itunu said, can I further my education on this healthcare visa? Itunu, I don't understand. Maybe you come to the stage and elaborate more, okay? Iman said, how do I put in my CV that I volunteer to care for my grandma and later my mother-in-law? It's very simple. All of them are different experience. What do you do? Come to your CV, write the dates, the period that you cared for them. So from this period to this period, write your grandmother's name. Okay, write your grandmother's name. Then you care. See, I care for my grandmother. The date, the interval is there already. Then you start putting your experience down afterwards. That's all. That place you used to put the name of the company, that name of the company there will not be the name of your grandma. That's just it. Your position, say carer, that's it, or senior carer, or healthcare assistant. It's the same thing. Just that the name of the hospital will not be the name of your grandma or the name of your whoever you cared for. Okay? Christina said, your CV video is superb. Thanks, Ada Wanile. Thank you, darling. Guys, Iman, you're on the stage. You want to talk?
Yes.
Okay, just give me small time. Let me attend to these people on the screen. Where can I get the non-diploma level 1 to 5? Emmanuel, you can get diploma anywhere. You can get on health and social care. You can get on Allison. You can get on London, forever. There are many of them. Okay. If you have not joined our what's that? Our Telegram, you can join. A lot of people are there too to tell you what is happening, because some people here, they are even more updated than I do. So you can as well Google where to get diploma, okay, and see more other options. Yeah, there's a lot of them. Obiageli, thank you so much. Lillian, I see you. So, Iman, go ahead with your question. I'm here.
Yes, actually, I sent a message to you on Telegram, the Medenta
Okay.
technologist.
Okay.
So, but I would love to go through these healthcare routes. But my question now is this: according to, though you've answered one question out of the two I have, then I have
Okay.
issue registering for this health and social care diploma on
Yeah.
health and fitness. So I don't know. Can I send money to someone in UK to pay on my behalf? And how do I go about that? Because I have a cousin there.
The truth is this: if you want to send someone to somebody you know to pay for it, you can do that. You get? And I keep saying it,
Yeah.
it mustn't be from health and social care, health and fitness. If you can pay for Allison courses are good too. Okay? All
Okay.
these courses, they
Okay.
are all the same thing. What matters is, like I said, health and social care was the one I did. Reason, they were doing promo. It was cheap for me. Me, they look for cheap things. I don't get money. I don't know if I'm
Yes,
communicating.
I also have their coupon code.
Yeah,
I also have a
uh-huh.
coupon code. They
Yeah.
reduce it
If
to
you have,
12,
yeah,
12
I
pounds for
screenshot.
me.
I don't know if I later posted it on the group. I wanted to show you guys. They are doing promo for Black Friday now, and their courses were
Yes,
highly
yes,
slapped. So this is the best
yes,
time to
12,
get a
12
course then.
pounds.
Yeah. So you can send money to your people in UK to help you pay. It's fine. Just give the person your login details. The person will log in and make the payment for you. That's all.
Okay. Sorry,
Yeah.
another question is this. I know how to drive, but it's automatic. Is it a must I learn these manual stuff?
My darling, me too. That is on this screen. It's only automatic I can drive. This is 21st century. I cannot go and be dragging clutches and the rest of them. I am for the
Okay.
soft life.
Okay.
I keep saying it. So whatever driving you can drive does not matter. My company will give you, I'll
Okay.
be going
Okay.
to the office tomorrow to pick my official car, and it's automatic. My own company, what you
Okay.
can drive is
Glad
the
to
car
hear
they
that.
will give you. Am I communicating? But the truth is
Yes,
this:
yes, yes.
there is more of manual cars in the UK. For instance, for long now, for the past 1 month we arrived here, we have been looking for a car to buy. Trust me, a lot of cars we see that we love are actually manual transmission. Of which me, I
Okay.
don't know how to drive manual, and I'm not even intending to learn manual. Okay? So if you
So
learn manual,
complicated.
one thing with UK is if you learn manual, you can drive both manual and automatic. So if you are still in
Okay.
Nigeria, it's not bad to learn with manual. It will also help you if you come here and you see a car you want to buy. Of course, manual cars are cheaper here too. Okay? You will not be
Okay.
limited
Yes.
like myself, right?
Okay.
So anyone
Yes,
you can
yes.
drive, it's okay.
Okay. Thank you. I really appreciate that.
You are welcome.
That's all for now.
All right, dear. Itunu, are you back? Can we hear you now?
Okay, yes, you can hear me. Thank you so much. So this is what I mean. I was trying to find out if on the visa I can actually do my masters. Probably, I know that the working hours can be flexible. So I was thinking, okay, can I probably choose night shifts and work on that? Can that visa allow me to apply to schools? That's what I'm just trying to find out.
Exactly. The truth with UK is this: you can work, you can go to school. Nobody is limiting you from not going to school. But just know that the hours you are contracted with your company is expecting you to do your hours. It depends on where you are employed. For instance, I'm in the domiciliary care. Domiciliary care does not have night shifts. Okay? The highest you can work is till 10 p.m., as the case may be, right? So if you are going to the care home where you can work night shifts, you can choose your shifts. Even me that's in domiciliary care, I told my employer, I know you work as high as 10 p.m. Don't give me shift that I will close 10 p.m. I have got kids. I want to end all my shifts high as 7 p.m. I don't know if I'm communicating now. So that's just it. You can work and you go to school. Know that your schooling will be part-time, because you cannot work full-time and go to school full-time. It will not balance. You might die in the process. Because one thing that kills people that fast is stress. Stress can be very dangerous, but we don't know. Stress is very dangerous. So you can be going to school and you are doing your masters. Even if you are at the NHS supports their staff with their masters. If you are in the NHS, you can be working, you are doing your masters, they will pay for it if you are lucky. Okay? So you can school and you are going to and you are doing your job. So that's it. Nobody's limiting you. You
All
can do
right,
your
thank you so much, Ada.
You're
One more
welcome.
question. Yes, I was told that, I don't know, I was reading up something online that if, for example, you get a 5-year sponsorship, for that 5 years, you cannot do any other job in the UK aside from healthcare. I just want to confirm, is
Exactly.
that true?
That is 100%
Okay,
right.
okay,
Yeah, that is
okay.
what this visa states. Like I am now, I'm an engineer. If tomorrow I want to, I see any, I said it before, I can code. I am good with programming language. If I see any job now that will pay me very well to program for them, I cannot do the job. Yes, because I'm restricted to only do care for this my 5 years visa. That's one downside of this visa. Okay, you cannot do any other thing that is not care. That's just the naked truth. But your dependent, your husband that is coming with you, can do any job of his choice. If he like, he can do 1 million hours. Nobody is after him. And now, this once you are being sponsored to come to the UK, let it stick to you that you have limited number of hours to do. For example, I signed 39 hours with my company per week. In a week, I have only that 9 hours to do with extra 20 hours. I cannot do more than that. If you do more than that, the UK government is waiting for you when you want to collect your Ali. So that's just it. But my dependent, which is my husband, can do work in any field of his choice. He can work for any number of hours he wants to work. That's just the way it is. I hope this answers your question. I think she's no longer on the screen. So while we wait for her, let me take questions from the comment
Hello, Ada,
section.
can I say something? Can I add
Hello, Ada.
something to what you said
I have
about these working
questions.
hours?
Okay.
Eh?
Yeah, okay, go ahead.
You see, I think you can do it with your main job. You can do even 50 hours with them. The problem is that if you're working with agency outside your job, you cannot do more than 20 hours outside your company. Now you're getting a 2 pay slip. With your company, you can get 60 hours pay slip with your main sponsor. But outside your main sponsor, you can't really do 20 hours,
My sister, just like I
more than
said,
20 hours.
you know, when we mention these hours, we think it's easy. It's not easy.
My love, I know.
So the truth is that at the end of the day, you will not do it. For example, as I am now, I'm not even planning to work for any agency because I have
Exactly.
a life to live. You
Yes.
get it now? The truth is that whatever my company is paying me is okay for me at the moment. And thank God my husband is working. Africans, let's learn to love our life and ourselves. All this too much stress is not taking you anywhere. There are a lot of jobs you can be doing in the UK. For example, my husband is into project management. Sometimes my husband works at home. He works at home and he earns more than me that is going outside every day. The idea is to work smart and earn your money. Too much stress is not good for the system. It's not good for you as an individual. So when we start dragging about how many hours to work, I laugh. Because this 9 hours I'm doing with my company, in a week is telling on me. In fact, sometimes I feel like it's too much. Not to talk of adding extra hours. You get it now?
Yeah.
So when you come in here, try to look at the aspects, as in for your dependent, not those of you that wants to come with this visa. Try to get a job that will make your dependent to work smart and make the money. It's not about too much stressing and running up and down. It's about working smart. That's the key word here. Sometimes I envy my husband. He's just at home. He's earning more money more than me. Sometimes he goes out to the field. So that's it. It's about working smart.
Yeah.
I still
Right.
say if I can do my programming and earn money, I will even leave this care job and run a program. You get? But the truth is that we must sacrifice something to get something.
To get something, yeah.
This
Very soon,
healthcare
5
now
years,
is
you
the
just come and go.
easiest to migrate now. It is what is going. I want to sacrifice these 5 years of my life to get this passport I'm looking for, right? So that's just
Oh,
it. You have to
yours is
sacrifice something
counting,
to get
man.
something.
Mm-hmm.
And the truth is that before you know it, 5 years is over. That's what we don't know. Before
Yes,
you
it's true.
close your eyes, 5 years is over. I just came to
Mm-hmm.
UK how many months? 1 month ago. 1 month
Mm-hmm.
I've started counting from you. I don't have up to 5
Mm-hmm.
years again. It's now 4
Yes,
years
that's true.
plus.
Plus,
So
yes, that's true.
patience is needed.
Mm. You're right.
So
Thank
let
you,
me
ma'am.
take some questions from the comments. Iman, I'm coming to you. Fed, I'm coming. This
Okay.
person, Chimama says, so in the case you explained about you caring for your grandma, how will you get reference? I keep saying this thing, guys. That's why I always hit it. Go and look for hospital or care home to volunteer. Caring for your grandma is not a formal experience. It is an informal experience. It is informal. You cannot get reference. You need a formal experience to have reference. Just volunteer a few months so that you can get reference that yes, you worked in social environments, right? Before this job became this competitive, caring for your grandma or whoever you cared for is enough for you to get the job. But the way things are going now, you need more formal experiences. Thank you, Raviro, for your compliment. This person say, can I get a job as a senior carer with 13 years experience or a care manager? Of course, you can get a job as a senior carer. You can. Even with 1 year experience, you can. Chimama, welcome that you provide so much charity and you are so, thank you, darling. Fumi said, please, ma, what is the difference between senior carer and healthcare assistant? Guys, I have explained this thing before. Did I not? I did. Senior carer, you are just like a leader. The healthcare assistant are reporting to you. That's just it, and you earn more. But in the field, all of you are doing the same job. It's just the difference is the leadership position and the salary. It's never the same. You earn more, definitely. So who is asking question?
I am.
Okay, Faith.
I'm asking
Well,
Let's
question.
okay, who should go
Okay.
first? Iman, do you
Yeah,
want to go
Fede
first?
is here. Fede, go ahead. Fede, go ahead.
Can I ask my question?
Okay. I
Okay.
thought Iman is going. Okay.
No.
Iman, please go on. Iman, go on so I can take
Okay,
care of
Emma,
this
you can
person.
go on then.
Okay. Actually, I've been working with Lagos State government. Like Lagos State government of fit to let me put it down for the past 5 years. Can I get a reference from there?
I
But as
don't
a
get
dental
what did you
technologist,
work for them? For Lagos State
as a
government,
dental
what did you work for
technologist,
them? Huh?
I work in the dental lab.
Okay. But the truth is this, okay? You are telling your employer now that you have been working as a senior carer, right?
Yes.
Your reference should come as a senior carer. I
Okay.
pasted something in one of my videos, someone that was in visa. He put a reference that he worked as a senior carer. Okay. Finally, his
Yes.
village followed him. UKVI find something tricky. They reached to his referee, and his referee said he works as a general hand, not a senior carer. He was automatically denied visa and was banned for 10 years. Okay? So let's be
Yes.
careful with all these things. That's why I strongly advise you, Emma. You can get a job as a dentist in the UK. Follow the NHS. They are your surest best. Go to track jobs. Look for dentist jobs with the NHS. You will get it. Register your license with HCPC. I think that's your body where you register. Do your license. If you want, chat me. I will send you the link to their group. Go there and find other dentists with you. Okay? Register with your body. Go as a dentist, my darling. You will not regret it. Emma. Is Emma still here? I think our network is bad. Iman, when you come back, I don't know if you are hearing me. Go as a dentist. I would strongly recommend you go as a dentist. written, you have been working as a dentist, you have a strong reference. There are a lot of NHS employment for dentists, and they are still in demand as well. So Fade, you can go on now. Fade, can you go on? Fade?
With Lagos State healthcare. Can you hear me?
Can you hear me? I can hear you. I can just hear you now. Guys,
hello,
if you are
can
here,
you hear me?
the like button. Share this video, guys. Share it. You don't spend any money to share this video. Fade, I am hearing you.
Okay. Okay. Okay, I said I retired with the Lagos State after a work of 15 years plus as a medical laboratory assistant. So, and I want to apply for an healthcare assistant. What do you think?
You have been working as what? Father, what were you working as?
Ada, can you hear me?
Yeah, come again. I didn't get your question well. Come again.
Medical laboratory assistant.
Okay.
I said I'd worked with the Lagos State as a medical laboratory assistant.
Okay.
So though voluntarily retired, and I'm trying to transit into the care, but it's a care environment that I'd worked all my life, 15 years plus, but in the laboratory segment.
Why don't you want to apply as a laboratory? What was your background? Did you study laboratory? Medical lab?
I did science laboratory and then microbiology.
You studied science laboratory and microbiology, right?
Yes, the HND, yes.
Have you checked for if there is sponsorship in your field?
No, I want to do transit into the care environment.
Okay,
yes.
now it's simple. Just look for hospital to volunteer as a healthcare, unless the people you work with, maybe the doctor you work under, can be able to give reference that you work as a healthcare assistant, no problem. Am I communicating?
Okay.
Like I said, someone I know was denied visa because of this. Okay? Saying you are a healthcare assistant, when they send reference is saying another thing. Am I communicating? Okay. So if you want to come as a healthcare assistant, you need to do the 15 care courses, get a diploma in health and social care, okay? Then make sure you have a reference that can reference that you worked as a healthcare assistant. That's just what you need.
Okay.
Yeah.
I also did a community, I cared for my father. I did a personal home care for my dad that had Alzheimer before he passed on. So I did that for quite.
So add it to your CV. Yes, add it to your CV. It's an informal care. Yeah.
Yes, so it's included in my CV and also in my cover letter.
Yes, add it in your CV. But the truth is, initially, when this job came out new, with this your exposure, we are good to go. But because of how competitive the job is, right? That's why you need to get a formal, make it formal so you can get a good reference. Am I communicating? Baby, because feed but we're gonna eat noodles. You get? So that's it. So see, being a mom vlogger is not easy. Being a mom vlogger is not easy. It comes with a lot of things.
Okay, I attended your live something today, and I've checked the description box to look up for the link for the Telegram, but I can't find it.
Okay, check my other video. Check the last video I uploaded. It's in the description box, darling.
Okay.
Check my other videos that I uploaded. The last video before this live, is in the description. So just go down to connect with me. You will see the link.
Okay. You said that you do health and social care in diploma. What? Which? I know I've not seen it on Alice. Which other site could you recommend for that?
I use me personally. That means you have not been watching my videos. Me personally, I did on health and fitness. I will advise you, go back to my videos. They will help you. Watch my videos on how I get this job. I listed even where you can register your CV and start getting job offers. Go and watch my video on CV. It will help you a lot to tailor your CV. Watch my video on cover letter. Watch all my videos and you see people who are testifying. I choose here testify about my interview video. I have a lot of amazing videos on this channel that will help you progress in this career. So it will be beneficial to you to watch those videos. You will gain a lot. I'm just bragging. I have to brag about it because I know what I put in to do all these videos. It's not easy.
Please do. Okay, I will do as you say.
No problem.
Thank you.
Please, if you have not subscribed, subscribe to my channel. Oh.
I have done that.
No problem. So who is next? Guys, share this live stream, okay? Hit the like button. Thank you, Regina. Okay, I love you too. This person said, I want to work as a caregiver. I am now a registered pharmacist. You can work as a caregiver. Just do the care certificates, the care courses. Start applying. Make sure you have someone to reference you that you're a caregiver. That's it. Kumari, I don't know if I'm communicating. If not, you might try your luck to see if you can see a sponsorship for pharmacists. But if you still want to come as a carer, you have to do the 15 care courses. It's a must. Okay, Kumari said you work as a nursing assistant in Sri Lanka Air Force. Then you are good to go then. Apply. Okay, so far the place you work can give you reference. Apply. Kezaya, yes, you're a bit late, but you can still join the discussion. I love you too, Bintu. Chimoma said, can a physiotherapist who attended to my grandma while I took care of her be a good source of reference? He was in a government hospital. Of course. So far, the person had his or her official email that you can give to your employer. See, guys, I keep saying it. My referee was a nurse in my organization where I worked, my fellow nurse, my fellow colleague. Anybody can reference you. Just make sure they have their official email. Once they have their official email, they can reference you. Even my husband is a nurse and he's in another hospital. He can reference me, guys. Be smart. Be smart about all these things. Okay? Yeah. Anybody can reference you. So shall I go ahead?
Yeah, good evening, ma.
Good evening.
How's work and everything?
My sister, we are pushing it gradually. It's not easy over here, I must confess. Shola? Hi guys, Shola, I'm waiting to hear from you, Shola. Again, before I forget, those of you with nursing background, those of you with healthcare background, have you guys heard about the nursing associates? I'm trying to do a video about it. It's another way to come instead of the healthcare assistants. What I'm trying to say, people should leave this healthcare assistant for those that does not have a nursing background. Try the nursing associates. I'm trying to do a video about this nursing associate because they are really employing them there now, and there's visa sponsorship. Even those of you that did what are they calling it? What do they call it? Auxiliary. You can get job as a nursing associate. It even pays higher than the healthcare assistant. I will do a proper video on the channel for it. So if you are in this category, please leave the HCA job for those people that are does not have any health background, please.
Hello, good evening, ma'am.
Yes, Binti, you can apply. Good evening, Shola. Shola, go ahead. I have been waiting for you to say something.
Yeah, thank you so much. I've been following up your video for some time now, and it's really encouraging. Thank you so much for the
You're welcome, dear.
So what I want to tell you is, I've prepared the CV and the cover letter. I've not written my IELTS now, and that's what I'm trying to work on, but I think I have to make my passport ready, the IELTS. That,
I don't get you, Shola. I didn't get you.
I
Can you
said
please come again?
I'll need my passport to register for the IELTS, right?
Yes, exactly. You need your passport to register for IELTS. That's the ideal
So I
thing to
think
do.
that's where I'm lacking behind. But for the experience, I think I've worked in an health center before, like for 3 years. I've had an experience.
Yeah. Okay, you have worked as a healthcare for 3 years, right?
So I had 3 years experience, and I
You
also
are good
have
to go.
former experience also with my uncle. So it's that also helped in my CV also. So I
Yeah.
added it. So
You
that's
see
why
all these your experiences, put them in your
Walaikum.
CV.
okay. Yeah, I'm writing the CV and the cover letter.
Yes, put them in your CV, okay? You are good to
But
go.
can I give a trial by when they are ready? I should just start applying before my documents are ready for passport and
Why not? Start
IFS.
applying. Start. I keep saying this. Start applying. So far, you have your CV and your cover letter. The only reason
Okay,
why I always advise you have every document, like IELTS, a lot of people that I know in person have missed a job because their IELTS was not ready. When they come back to tell the employer I've gotten an IELTS, they will tell them, sorry, no vacancy. They have taken another person that is ready. Okay?
okay,
So while you are
okay,
waiting to gather your documents, you can start applying.
okay, no problem.
Yeah.
I was restricted in applying before, so I said, let me just
Yes.
confirm.
No, be
Thank
applying, but just know that you might lose a job if your IELTS is not ready. But
you
that's not my
already.
prayer for you, okay? So start
Okay, yeah.
applying and work on getting your documents because they are necessary.
Okay, thank you so much, ma.
You're welcome,
Then
Shola,
aspect of
anytime.
reference, ma. Do you have aspect of reference, ma? Is it
Yeah.
just one reference I'll be needing or more than one?
What the reference they need is two references. I keep saying it. Okay.
Okay,
In my case, I use one reference from my office. The second reference was a character reference, and it's still a nurse that referenced me. Okay, so that's it. But you must they require two references.
where I worked and got 3 years experience, I can get a reference from it. Then my
You will get a
present work
reference.
right now is not under health center or health background. Can I still get a reference from that to make
No, it must
those
be a
two
health
references?
background. Unless you
The two
stated to your
references must
employer,
come from health
unless you
background.
stated to your employer that this is a character reference. Okay?
Okay, okay. Thank you
Me
so much, ma. I
personally, I got
understand that
my
point.
reference from notice. All right, you're welcome.
I have a question.
Okay,
Positive
Emma,
for us, ma. Thank you so much.
you're welcome.
My husband want me to be applying without IELTS. Though I intend writing my IELTS next month, but he
Mm.
wants me to start applying now, and I don't have a driving license yet. So I don't know if I should go ahead
My
with
dear,
the.
start applying. I keep saying
Okay,
this. Once you have
okay,
your cover letter and a good CV, start
okay.
applying. But the
All
thing
right.
is this, you might get an employer that is willing to sponsor you now. And if you don't have your IELTS and those necessary documents, they will not look at you again. And maybe the time you will come back with these documents, it is over. They have given to another person. Okay?
Okay,
So,
okay,
but
okay.
that does not mean you shouldn't apply. Please start applying.
All right. Okay.
So,
Thanks.
guys, yeah, let's take some questions from the background. I have a lot of questions here. Oluwatosin said, I can drive, but on the process of getting a driver's license, is it advisable to start applying for jobs that require a license? Will I have to show them a driver's license at the point of interview? Now, this is it. You can start applying. Apply to all jobs. Okay? Me personally, I have all my documents. Before I apply, I attach every document. I keep saying this. I attach my CV, my cover letter, my driver's license, my IELTS, and all my care certificates that I have merged in one PDF. This was what worked for me. So if you don't have a driver's license, my darling, it's not every job that requires driver's license. I keep saying it. The only jobs that require you to drive is those in the domiciliary care. Care homes does not require you to have a driver's license. So there, go ahead and keep applying. So your license is out. Okay? Me trying to upload all these documents is to show my employer that I am ready. That's just it. It's just a means of telling these people I am ready for this job. Okay? So please go ahead and apply while you wait for your license. Obiageli said, Ada, please, after getting my passport, what is the next step for me? Obiageli, I think this is your question. If you have not watched my video on how I got this job, go there and watch the video. I listed all the required documents you need. After getting your passport, have you written IELTS? Have you done your CV? You have a long way to go. So go back now, go to my video, start watching them step by step. How to get, I got the job, every document, every information is there. Relax and watch it back to back. Don't skip it because you might miss an important update. Watch my video on CV, go and structure your CV. Watch my cover letter, know how to apply and all that. Obiageli, go and check that video out. Tracy said, I have a national diploma in community health. Just finished my final year in BSc Public Health. Worked in a hospital setting for 5 years. Please, where do I fit in? Dear Obiageli, I will advise, dear Tracy, can you check NHS and know if there is any sponsored job for health, public health? If not, you can as well come in as a senior carer or a healthcare assistant. You are good to go. I don't know what you worked like as in the hospital. Can you tell me what you worked as in the hospital? Trace, this is for you. If it's possible, you can come on the stage and let's communicate. Regina said, I have three nursing diploma certificates from Allison. Can I use it as apply for nursing associates? Well, Regina, you people should give me time. I will research on this nursing associate. The video will come up next week. This week, the video coming on Thursday, like I said, is to teach you how to write a supporting document for NHS job application. When I was applying, I got a lot of job from NHS, but unfortunately, they needed someone in the UK already. Okay. So I will teach you guys how to do these things to get notice, and the band you should be applying as. That's the next video coming up. The next one will be a video. You guys will see it. But this nursing associate, I will do a detailed video. Let me do the research. Like I said, I don't like giving out information that I am not sure of. I don't like giving out fake information. I like to do my research well and come out with something tangible. Obiageli said, emphasize more on the character reference. Character reference is just a reference telling that they know you, they know who you are, they know you are kind, you're empathetic. Maybe they have worked with you in one way or the other. Okay, like I said, I still use a nurse as my character reference. Okay, that's what character reference is. It's just someone to say that they know you can do this job, they know you are kind, you are a caring person, they have known you for so number of years. That's what character reference is. So you can use one professional reference and one character reference, depending on your employer. In my case, my employer never mind, but luckily I use a nurse for my character reference. Marky says, please, the diploma course you did you pay for the course and certificate separately or just the course? Now, I keep saying it. I did my diploma in health and fitness. When I did my own, they were doing promo. The 20 pounds I paid was both the course, the certificate, and the transcript. Everything was in cash. I did not pay any other money. And I keep saying this. Before you pay for a course in health and fitness, please make sure it is both the certificate and the transcripts. If not, email them before payment and tell them, see what you are looking at. Okay? And again, once you are making the payment, there is an order number. Screenshot your order number. save it somewhere. That other number is what you use to claim your certificates. Am I communicating? Beatrice, you're welcome. Beatrice say positivity gain. I'm a diploma general nurse in Ghana. I have my highest overall mark of 8.5. Will you advise I go for ACA or RN or even nursing associate? Beatrice, the diploma nurse you're talking about, are you talking about you went to a university and you obtained diploma in nursing, or is it online course? Expatiate more. If it's possible, come to the stage and explain yourself well. Let me know how to answer you, okay? Emma, do you have anything to say? Emma. Emma, please off your mic. Emma, mute yourself, please. Emma, mute your voice. Mute your mic. So, guys, if you still want to come to the stage, please come to the stage, please. Okay, Beatrice, you say you did nursing training. That means you did auxiliary nursing. You can try the nursing associates. I will try and do my research well and come up with how to go about it. And the video will come up next week. All of you should anticipate it. Guys, who else is coming to the stage? If you have your question, guys, drop it. If you want to come to the stage, hop on. I still have up to 1 hour to spend with you guys today. And if you are here, you have not subscribed to my channel, come on, what are you waiting for? Hit the red button and join my family, okay? Subscribe, guys. Share this live. Hit the like button too. Share us out so that other people will join this live stream. Robert is here. Welcome, Robert. I am Robert, an Ugandan. I have a diploma in education, secondary biology. Can I apply too? Of course, Robert. You are free to apply. It's for everybody. Even if you don't even have a diploma, you only wrote your WAEC or your GCE, you can get this job. Just go ahead and do the 15K courses. You might like to watch my video on how I get this job. I listed all the documents you need, where to get this job and all that. Do an outstanding CV, upgrade your cover letter, and start applying. Who is this dear? Dear, I cannot add you to the stream. Emma, please mute yourself. That's why I removed you. Your video was echoing unless you want to say something. Beatrice, you're welcome. Do you have any question? Emma, mute yourself. Beatrice.
Oh, I was trying to say that I've completed my school and I've written my exams, my English proficiency exams of overall band of 8.5. But then I was contemplating whether I should go for the RN or the healthcare assistant or even the NP.
Beatrice, I just answered you. I told you that from what you said, you just did auxiliary nursing. The only thing you can go for is either a senior carer or a nursing associate or a healthcare assistant. You cannot work in the United Kingdom as a registered nurse because you didn't do a proper university course in nursing.
Okay.
Thank you, Rosemary. Thank you for coming. The family is good. Obageri, join our Telegram group. Someone in the group is sending materials, IELTS materials to the members of the group. So join our Telegram group. The link is in one of my videos, okay? Check my videos on YouTube. You'll find the link to our Telegram group. Join there and drop your email address. Someone will send you a material. A good Samaritan is doing that for us in the group. Guys, if you are here, you have not subscribed to my channel, hit the red button and be part of this family. Like this video, share this video out so that people will join us. Okay, don't be stingy with the information here. Loveline, you're welcome. Loveline said, Ada, God will bless you greatly for this live video. Thank you, Loveline. Thank you. I love said, Mama, please, with the health and social care certificate, I'm seeing a lot of the health and fitness academy sites. I'm confused on what to choose. We have health and social care level 3. Yeah, you can do the level 3. Level 3 is good. Go ahead and do the level 3. Okay. Loveline. Okay. Thank you, Loveline. I love. Go ahead and do the level 3. Guys, come up with your question. Who else is coming to the screen? You guys have left only me on the screen. Guys, look at our necklace. So I'm wrapping our necklace in this live video. Who else is coming to the screen? I love. Do the level 2 or level 3 is good. Someone should come to this to the stage now. We have 47 million amazing people in the building. Guys, come up to the stage. I have interesting videos coming up this week, guys. Guys, always try to share my video. Please share us out. Emma, do you have a question?
Yes, I have an issue. Let me put it that way.
All right.
I met with like 3 hospital owners that we work together in the same hospital. They have private hospital, but their bill is just something else. They're asking for 200K. I told them that I'll volunteer to do like maybe for a month or so because of the nature of my job. That at least maybe two times in a week I'll be coming. But they said I should pay 200,000 before they can get they can give me certification or reference. I don't know how to go about it. But I have someone. The person is a dentist, let me put it that way. So she's ready to render her help. I don't know
No,
if
it
I
doesn't
can
mean
get
anything. Now, if the person can reference you, no problem. So far, the person have an official email. You have been working in the hospital, you have the experience, right?
Yes.
So far, the person have an official email to reference you. Don't stress yourself.
Okay. Thank you.
You're welcome.
Okay, I'm back again.
Okay, hold on there. Keep Christy. Please, if you see MVQ, do MVQ, please. Thank you. Do MVQ. MVQ are quite costly. I keep saying this. If you have money to do MVQ, guys, do MVQ level 2 or level 3. I will suggest level 3. If you have money, do MVQ level 3. Yes, please. Don't misquote me. Me, I did not do any MVQ. I just did the level 2 diploma in health and social care on health and fitness. And it landed me a senior carer position. Grace levels are not the same. Companies are not the same. So if you have money to do MVQ level 2 or 3, and I will highly recommend level 3, please do it. Faith, go ahead.
So, like the diploma I told you about.
Hold on, Faith. Emma, can you mute yourself? Emma, mute yourself if you are not talking. Okay. Faith, go ahead.
Okay, so like the diploma I told you about caregiving. What's the rating of that diploma?
Which one?
Caregiving. Diploma in caregiving under Alice.
My dear, I keep saying this. I have never been to. I don't even know how Alice's courses look like. I have not done any course on Allison, so I wouldn't know until I get the certificate. You get? See, guys, I only do these 15 care courses on Florence, which is free, and the 20 pounds course I did in health and fitness, and I got the job. Grace levels are not the same. Your CV, how you package yourself matters. Okay, so this was not my case. I don't want to say what I don't know. Okay.
Okay. So I want to give you my background. I want to give you my background so you can advise me on what position to actually go for.
Okay, go ahead.
I the statistics.
Okay.
But for like 15 years now, I've been a social worker. I'm a certified counselor tester, HIV and AIDS. Then in 2011, I had a training on home-based care.
Okay.
Since then, I've been working at under family planning and some other, basically social work, social care, basically social care. Then For some time now, I've actually left the social care field. I've been in tech. I'm now in tech, but not too deep in tech, basically managing of clients under a tech company. So I'm just looking at where can I really fit in that I know I won't get stressed up. Because it's one thing to get a job, it's another thing to maintain your job. So a lot of people just like, oh, I want to be this, I want to be that. But you're not looking at the stress involved, like you said earlier on. There are a lot of challenges attached to this job. So where do you think I can fit in?
Where you can fit in is senior carer or healthcare assistant.
Okay.
Because your major background is in statistics, right?
Yes.
You have never gone to do nursing what do they call it? This nursing training, right?
Okay, like 2017 to 2020, when my dad died, I basically took care of him. Though I had a nurse that comes check him up, I did all his bedside treatment and everything.
You
So
are
that's
good to
one
go for
experience
a
I
healthcare
have.
assistant or a senior carer. Just put it in your
Okay.
CV. Okay?
Okay.
This is what you
Okay.
did. This is what you fit in.
Okay. Thank you so much. I'm
You're
grateful.
welcome.
I'm better now. Thanks. God
You're
bless
welcome.
you.
You're welcome. So guys, let's take some questions from the screen. Kumari said, how can I apply, madam? Kumari, go to my video on how I got this job. I listed everything there. Go to my channel and watch those videos. Okay? Chichi Christy. Allison is nice. Yeah, Allison is nice. All these things is your money. If you have money is good. No knowledge is a waste. 2 courses. Farmer Joe, you're welcome. Good evening. Please, I studied law in school. Should I put that on my CV or just the experience of taking care of my dad? Dear Farmer Joe, the only experience you need in this job is healthcare experience. But in your education, put your law background. Go and watch my video about CV. You will see how I structured my CV. Look at it and have it as a guide to do yours. I still put down there that I studied mechanical engineering. It's still in my CV. But all my job descriptions is in health field. So, Ojo, go to that CV and have a look. Trust me, it will change your story. It will help you. Chioma Chukwuemeka, welcome. Keziah said, I did auxiliary nursing too, but the professional reference, how can I go about it? Keziah, I said this thing now. For the nursing associate, give me time, all of you. I will upload a video about it next week. I will do my research and know the documents they require from you. So if they need reference, I will still do my research and know how you can go about it, okay? Give me till next week to do that one, because for this week, I have done 2 videos already that will coming up on Thursday and Sunday respectively. Robert, go to my last video on this channel. You will see, go to the description box. You will see the link to the Telegram. I cannot go to the Telegram now to get the link because I will cut this video. I will move out from this live. So go to my video, the last video I upload. You will see the Telegram link on the description box. Go to the description box, keep scrolling down. You will find the Telegram link there. Kumari is still asking me how I applied. Kumari, go and watch my video on what's the name? On how I got this job. You will see everything. All the information you need is there. Because it's quite a long process. Guys, do we still have any questions? Guys, drop your questions. I have like 30, it's not up to 30 minutes. I have 23 minutes to stay with you guys. We will be ending this live once it's 7 p.m. on the dot. Because I need to attend to the family. Guys, if you have not subscribed to my channel, please hit the like button, okay? And share this video out so others will benefit. Chioma Chukwuemeka said, I don't have an experience, but I have someone who will reference me. But our hospital isn't taking voluntary for now. Can I go with our reference and get my experiences online? Well, if you can get your experiences online, if you think you can, that's fine. The truth is this: when these people are interviewing you, they know if you have experience or not. But if you can be smart about it, it's left for you. You can definitely get the job once you have someone to reference you. But I would strongly advise, try, even if it's few months, try and look at what they are doing and know if this is what you can actually do. So you don't come to the UK and start regretting. You don't come here and start saying, I don't know it is like this. The truth nobody tells you is healthcare job is not easy. Working in the hospital generally is not easy. You have to be a patient person. You have to endure a lot of things because you will see a lot with your eyes. You will see things that your eyes cannot, that your mouth cannot talk. Okay, it requires patience and empathy. So that's why I strongly recommend go into the hospital setting and look at what these people are doing and ask yourself if you can do it. Later on this channel, maybe next week, I will upload a video on other job professionals that are sponsoring people from abroad. In case if healthcare is not for you, you can come via this route. Okay, I will do that video next week. So please, going to get experience. Okay, you have informal experience, then it's good to go. No problem. Thank you, Ada, for all you are doing. God bless you. Please, can IELTS General be used when applying for job? For UK job, it must be UKVI IELTS General. So if your IELTS General is UKVI, then you can use it. You are good to go. But if it's not UKVI, they will not look at you there. I have an informal experience. Okay, Choma Chukwuemeka, you are good to go then. You are good to go since you have a reference. No problem. Welcome, IT. Welcome to the screen, IT.
Thank you. Thank you.
You're welcome. IT, you want to ask a question? Go ahead.
Okay, yes, please. My experience is also informal. I actually took care of my grandma who had dementia before she passed on some years back. But aside that, I have not done anything in a formal setting. But I was able to speak with someone who owns a hospital who is willing to reference me when the time comes.
Okay.
But at the moment, I'm still trying to take the care courses and put my certificate together. I haven't done IELTS yet. But I wanted to ask if I could start application before the IELTS as soon as my care course certificates are ready.
Exactly. You can start your application anytime you want, darling. The only thing is this. You might be lucky you apply today. Like I posted a testimony, someone that shared my video with her sister. Her sister changed her CV using my CV.
I read it.
The next day she got a job interview. So you might be that fortunate, right? And when they now ask for your IELTS, you don't have it. My dear, they will drop you. And when they go to the next person, you might lose that opportunity. When you will come back, they will tell you no vacancy. You get it now. So grade level is not the same. There are people that will apply today, tomorrow they have gotten the job. There are people that will be applying, they have not seen job. Okay, you can start applying. The ball is in your court. But if you can gather all your documents, you get it gives you this push like you are ready. Okay, when you have all your documents close to you, the zeal is there. If you can understand, that's what happened in my own case.
Yeah.
The zeal is there. The zeal is there.
I also wanted to confirm the IELTS for this care job is different from the IELTS for the study route, right?
Yes, they are different IELTS.
Wow. Okay.
The care job is UKVI General IELTS.
Okay. All right.
Which one do you have? Which IELTS do you have?
I haven't written. I'm just trying to prepare now because I'm also trying to attempt the study route. Anyone that works.
Yes, like in my case, I keep telling you guys, I got job in 10 different schools. I got admission. What did I use? My WAEC. If you have English from C6 up in WAEC, you can use your WAEC for study route. You don't even need to write IELTS. So for my study route, I use my WAEC result as my English language proficiency. So you can use your WAEC. No need to write to IELTS. Okay.
Okay. Thank you.
You're
And
welcome.
I also learned that this NARIC is an alternative to IELTS.
Exactly. You can use NARIC. You can use EXIS.
Okay. I'm trying to get my transcript too and see if that will be better for me.
Okay, that's perfect there. That's perfect.
Okay. Oh, thank you so much, ma. I
You're
really
welcome.
appreciate.
You're welcome. Dear, can we hear from you, dear? Welcome, Bridget Ike. Dear have gone out again. I think our internet is bad. Dear, ask your question. Diola, ask your question if you have one. Bridget says, is care home the same as hospital? Please correct me if I am wrong. Most of our experience are informal because relations take care of age in our country. Care home is different from hospital. Care home is a home where aged people are being taken care of, okay? Maybe someone is aged, nobody to take care of him or her. The family have moved on with their lives. They will bring the person to the care home where people can take care of him or her. Hospital is where people that are really sick are. Okay, in the care home, people that are not sick are in the care home. Just that they need support, they need help with basic life challenges like personal care, making sure they shower, they eat, they brush their teeth, helping them to get on and off from the bed and all that stuff, right? But in the hospital is where sick people are mostly. Okay, so there are two different scenarios. That's just what it is. So Bridget, I hope this answered your question. So if you have an informal experience taking care of your age relation in your country, yes, you can work both in the hospital and in the care home. You can work anywhere, right? You can work anywhere. Regina Ikechuku said, I have UKVI academic. You can use it. What if people need is UKVI IELTS? Whether UKVI general or UKVI academic is okay. So far it is UKVI. Please, I love say, please, with the senior carer when searching for jobs, do you type senior carer or just healthcare assistant? Like I said, some companies say they need a senior carer. Some will say senior care assistant. Some will say healthcare assistant. Search for all of them, okay? Just on Indeed, you can see how you can order for all of them. You will see, you can type healthcare assistant on your alert, senior carer on your alert, senior care assistant. Put on your alert. You'll be getting alert for all of them. At the end of the day, it is the same job, guys. It all depends on the company's language, what they use to describe it. Diola, do you have any question? And welcome on board. Bridget Ike said, thank you for your explanation. So why are people going to hospital to get experience? Yes, people are going to hospital to get a formal experience because you will need a reference. It's only those in the hospital that might have a formal email address that you can use to get an experience, a reference letter, okay? And also, getting experience in the hospital is not a bad idea. It broadens your horizon. What if the certificate states British Council IELTS? Guys, all this IELTS is British Council. Come on. IELTS is owned by the British. It is British Council. There is normal IELTS. There is UKVI IELTS. Please, all IELTS you are writing should be UKVI. Diola, do you have to say anything? Do you want to say anything, Diola? Guys, we will be ending this live in 13 minutes. If you have questions, come up now or drop it in the comment section. Thank you, Bridget. Farmer just said, if I have a long gap in my CV, will they still employ me? Thank you. My dear, I always advise people, cover any long gap in your CV. This is my advice. I keep saying this, work smart. If you have a gap in your CV, you can put in there that you cared for your great grandma. Look for something and fill up the gap, okay? I don't advise people leaving a gap in their CV. Be smart about these things. This is about you. If you know anything you can do to get this job, do it and do it right. Welcome to the stream, Keziah. Thank you, Regina. Thank you so much. Chioma Chukwuemeka said, if you are sponsored by a company and you got there, you don't like your employer, can you cancel your contract? Of course, you can change your employer if you got here, but we are all human. For someone to bring you, you know what it means for you to get course. You have to work for them for some months. In UK, nobody forces labor on you. Nobody forces you to work. As I am now, if I don't like my employer, before I switch employer, I have to make sure I get another employer that will sponsor me. I will start the sponsor process before you leave your employer that brings you. Of course, you can change your contract, you can cancel it, you can move to another employer, but make sure you have gotten another person willing to sponsor you before you cancel your employment. If not, see yourself back to your home country. Keziah, go ahead with your question there. Welcome to the stage.
Like you said before, I am in an auxiliary nursing, so I would actually appreciate your video on that, and thank you for assuring us that you're going to make a video on that. But my question now is pertaining to the professional reference, because I've done courses on Alison and also on Florence actually. So like about this professional reference from my hospital. I worked in the hospital I at least for 2 years, and then when I was also doing my placement as a nursing, as an auxiliary nurse, I also did this thing there too. So now how do I get professional reference from my school and also from the hospital that I'm working?
Okay, the truth is this: you can as well get a professional a reference from your school, okay, and get from the hospital, no problem. So far, the person that will reference you from your school will give a good reference about you. You can use the person as a character reference. The person can state, yes, she's in our school, I know her, she's capable, she's caring, she's empathetic, she can do the job, something like that.
Okay.
You can.
Okay. Thank you very much.
You're welcome, dear. So let's take some questions. Chioma Chukwuemeka said, will it affect the number of years on your visa? Oh no, it does not have any effect on the number of years on your visa. Changing employer, when you go to the new employer, your years are still counting for you. Okay, you will not start counting afresh. No, nothing like that. See, one thing I love about the United Kingdom is this country have laws that are guiding them. Nobody will force you in this country to do a work you don't want to do. In fact, as I am, for example, I have work on Wednesday. If I wake up tomorrow and decide I don't want to go to work on Wednesday, I will phone my office and tell them, see, my mental health is this and that. I cannot be at work today. Nobody will penalize me. Nobody will sack me. They will give me that time to take care of myself, right? So that's just the way it is. Nobody is forcing you to do anything in this country. So the next question is, Asin Oslai said, can I get a part-time job as a senior carer with my 20 hours allocated to me at the Yes, Famojo, please mute yourself. Yes, Asin, you can get a part-time job as a senior carer while you are studying. Abimbola said, how do I join the live video? Abimbola, you are in the live video. You want to come on stage? I pinned a link. Look at the pinned comments on the comment section.
Hello.
I pinned the link. Click on the link and come up to the stage. Adiola said, yeah, Ojo, wait for me. I'm coming to you, okay? Hold on.
Okay.
Adiola said, I have been getting jobs with companies that don't offer course, but hardly get jobs with companies that offer course. What am I doing wrong? If companies that don't have course are getting to you, that means you are doing well. Keep applying. Don't give up. One day you will definitely come across those that have course. Okay? So for those that don't have course are getting to you, that means you are good to go. You will still apply, get the ones that have course. Trust me, you will. Famoja, over to you now.
Okay, good evening.
Good evening, darling. Welcome to the live
stream. Thank you very much. Thank you so much for I've been, listening to you from the one that you started your videos and all. I have some questions.
Number one, for somebody that finished university a long time ago,
Okay.
if you are doing your CV, just like you said, that we're supposed to fill up all the gaps and everything, how do I do the CV for such a person?
Which person?
No, that's what I'm saying. I mean, like, if you finished a long time ago, school a long time ago, all those years, how
My
would
dear,
you not
I
put
think
all the
it's not
jobs that you
everything,
have done in the past?
we say on camera. If you finish,
Sorry?
let's say 10 years ago, you want to do your CV, you can as well say between that gap to where you are working now, you have been taking care of so people. You can list them 5 people step that you took care of. Just put in the description, see what I did for them, right?
Okay.
You can say you took care of your grandmother. Was I there to know if you did that? Was your employer there to know if you do that? Guys, this is very simple. What you say is what your employer know. Just be smart about these things and make sure you have the experience, because the interview question will come, definitely.
Yes.
Am I
But I'm
communicating?
saying that you can't say that you've been doing healthcare for 10 years when.
Who said that? It's possible. It's possible. It's possible you are doing healthcare for 10 years. My sister in this country have colleagues.
You say you do
I
healthcare for
have
10
two
years.
of my colleagues that are over
What
60
of
years.
you interview?
They have been in care. Over 60 years old women. Some of them told me they have been doing care since 25 years. Come on. You can be doing care for over 10 years. It's a profession, it's a job. One thing with Oyibo people, they respect your decision. They respect whatever you do. Nobody wants to know how many years you have been doing it. What matters is that you are good at what you are doing. Am I communicating?
Yes, okay. So I should not put there
Ask her, I said,
that I've
what
worked
happened?
in.
She said this is what she loves you. She don't want to stay at home. So that's it.
Okay, so I should not put there that I've worked in offices or anything. Everything must be related to healthcare.
You should not put there that you have worked where.
In offices, like maybe you
No,
worked
remove
in
it in
an
your CV.
organization.
Everything there should be about health. Yeah.
Okay, all right. Okay, that's my question. Thank you very much.
You're welcome. Guys, who else wants to come up? Olayinka, you came up and you went back. Guys, drop your question. We'll be rounding up in 5 minutes time, guys, because I have got to attend to my kids. That's the stress 2 hours I have been sitting here. Drop your question, guys, and we are rounding up. Guys, this is the first day of this live stream. If you guys love this live stream and you want us to do more, after this video, drop it in the comment section. In the normal comment section, tell me you need more so that I can schedule something like this where we can have, an interactive session like this, okay? Bridget, you want to come up? There is a link on the description. Look at the link, that place you are typing. Look up. I pinned the comments. Click on that link and come up the stage. Guys, if you want more of this live stream, tell me on the comment section. If you have not subscribed to my channel, please do well to hit the red button, okay? Yeah, Trendy World by Ihoma. You are welcome, darling. Don't worry, you can catch up later. We said a lot of things that might interest you. I must see you and give you a big hug. My dear, I'm waiting for you. You are coming to the UK. No cap. No, all of you, don't worry. We'll host a party in the UK. That's why I'm doing all this. I need neighbors in the UK, guys. I need neighbors. I need that Niger vibes, okay? I need all of you here so that we can party. Regina. Okay, Regina, if you need more, just comment on the comment section, not on the live comments, on the comment section, okay? That will help me to look at it and know what you people think, and then because these comments on the live might go, but those ones will stay. Okay? Guys, if there is no more questions, maybe we'll be looking at ending this vlog. Okay, Choma said, what of someone who has informal experience of going to people's home to help with home chores and taking care of their family members, but not with a care home as an individual? Exactly. Domiciliary care here in UK, this is what we do. We go to people's home to render care. They are not in the care home. These people have decided to stay in their own home. They don't want to go to the care home or the hospital. We go to their house and render care. Put it in your CV. Say that you have been doing domiciliary care. That is what is called community or domiciliary care. It's care, darling. Put it on your CV, okay? Bridget said, is age a barrier for overseas applicant for someone that is 53? Trust me, guys, age is never a barrier. Even when you apply to job, you see where they say they don't look at your age. Nobody will deny you a job because of your age. All right? Nobody will do that in the UK. So far, you are physically fit to do the job. Nobody will deny you because of age. Age and gender. Nobody will deny you a job because of your age or because of your gender. Nobody. Or even your sexual orientation. Nobody will do that. So, guys, thank you guys for coming. I need it as an individual, not with a company. How can I make it formal? I don't understand, Joma. I need it as an individual. Can you come up the stage and briefly say what you're talking about? Because I don't understand this, your last question. How can you make it formal? How? My dear Lillian, now so I keep saying, not be everything we go talk for public. As we there here now, we don't know who is listening, but they know they hear. So, guys, if you have not subscribed, do well to subscribe to my channel. If you want to join the channel membership, of course, go ahead. I have my separate mentorship too for my channel members. Go ahead and become part of our member. Guys, share our video out, okay? Share us out and be blessed. Of course, companies are still recruiting from overseas. They are. Just that you have to be serious and keep applying. Onyinye Letitia, welcome. What of someone that is working in a hospital but not as a carer? What are you working as in a hospital, Letitia? Trendy World said, are that baby positivity lady? Are there still companies recruiting from healthcare? Yes, sure, they are. Just keep applying on Indeed. All those job sites I mentioned. LinkedIn. Guys, LinkedIn is very powerful. Indeed is overpowerful. You guys don't know the powers of these websites. Register your CV there. Be applying. All your documents, have them on your phone, your CV, every document. Once you see a job, apply on the go. Apply as you go, okay? Onyinye, as a lab scientist, I have said this thing before, you are late. I think you have to wait till our next live. I treated these lab scientist issues in this video. Onyinye, you are late. You are just coming in now. I will advise you, cool down and watch this video over. I have said something about lab scientists because I need to end this live as soon as possible. Simon Dixon, can I hear you? I love you too, Bridget. I love you all too. Simon, can you ask your question? I will be going off very soon. Yes, I love you too, Lillian. Yes, Simon. I can't hear you, darling. Can you increase?
Yes.
Hello, Simon. So I mean, I did that job as an individual. I wasn't employed by a company, more of like a house help, as you see it in Nigeria. Okay, yes, if your employer, guys, let me say this. Since you are doing that as an individual, Chioma, and the person you work for, if the person has an official email address that he can reference you, why not? Still put it on your CV, okay? Ask your employer if he, so, guys, I don't know if you guys can hear me. Ask your employer if he or she can reference you. Nothing is there. Regina, thank you. Thank you, guys. Good night, Regina. Thank you, positively. Let me watch what you did later. You are the best. Thank you, darling. Trendy World, I love you too, darling. Please rewatch it. You will see things that might interest you. Chama, please, I will tackle this your issue in my next live. Try and come early and come to the stage, okay? Now I will be going off. Adewoye, someone with experience in guidance and counseling is a mathematics teacher. You need to go to the hospital and render care, okay? You need to go and volunteer in the hospital. Blessing, honor, you have been a good motivator to us. Thank you, Blessing. Thank you, guys. So, guys, we'll be ending this live video here, okay? If you come late, you can go and rewatch the live later. Relax, it might be long, but it's worth it, okay? So, guys, at this junction, I want to say this. Before I leave you guys, keep pushing, never give up. You see LinkedIn, you see Indeed, you see track jobs, you see these job websites. Don't take them for granted. Don't you ever take them for granted. Yesterday, I posted on the group of a job that just expired on Indeed. They were looking for people to sponsor from overseas. But many of you didn't see it because you think it's not working. I got my job on Indeed. I cannot stop saying this. This is my reality. Keep applying. That you are getting, unfortunately, shouldn't discourage you. Keep applying. It happened to all of us. Everybody that came to UK via this route, if the person should be truthful to you, it happened to all of us. At a point, I gave up applying because of the unfortunately I'm getting. It's a normal thing. But one thing is for sure. One day, one will click. One good day, one will click. Take this thing home. It's a new week, guys. A new week with a positive energy. Guys, positivity is all you need. Be positive. Declare positivity upon your life and upon this journey. Keep applying. Be positive about it. Bring in the energy. This job needs you to put in the work. Nothing happens on a platter of gold. You have to pay the price, right? The price you are paying is what you are doing now, is how you are applying now. One Richie Cordry, you are late. You can go back and rewatch this video, okay? You say, how do I go about it? I need healthcare assistant job. Go and watch my video on how I got this job. It's on this channel. Go through my channel. You will know what to do. You can join the Telegram group because we are closing this live. I'm almost 5 minutes late. So, guys, it's a new week, guys. Getting the energy for the week. Keep applying. Arrange your CV. Arrange your cover letter. Get all your documents. I have taught you how to apply. Go there and excel. I wish all of you the best this new week. And I'm hoping for a great testimony in this family. Positivity, gang, don't forget, positivity is the key. And prayer should be there too to support you in the journey. I wish every one of you here the best of luck. Like I said, if you enjoy this life and you want us to be doing something like this subsequently, maybe once in a week, type in the comment section, not on the live, this video on the comment section, type there that you want more of this. Then I will be arranging live section like this, where we can sit down, come on the stage, gist, and talk about our challenges, and we will address it together. Okay? Thank you guys for tuning in. Thank you guys for supporting me. And if you have not subscribed, hit the button down below and be a part of my family. You might also want to join my channel membership, guys. It is worth it. Okay? If you can, join my channel membership and see what happens after that. Okay? Thank you guys for coming. Thank you. And I will see you guys on Thursday during our premiere. Okay? Bye, guys. Bye, and good luck, guys. Bye, guys. Thank you, Chikodle. Thank you. Thank you. Thank you, Regina. Thank you, Egwono. Thank you, everybody. Thank you. Thank you. Thank you. Blessing, all of you. I cannot see all your names from here. Bye, guys. Let me attend to my kids. Like, seriously, guys, I don't even want to end this live. It was so encouraging. It was so interactive. Let me say this. It was so interactive, but I have to go. Bye, guys, and I'll see you guys on Thursday. Bye. And do me well to share my videos out, please. Bye.